Today we are going to discuss about auditory tube or eustachian tube or pharyngotympanic tube. So eustachian tube or auditory means something to do with hearing. So hence the name auditory tube. Then pharyngotympanic tube because it communicates the nasopharynx to tympanum, that is middle ear cavity. Hence the name pharyngotympanic tube. So this is one of the components of Monday's class. So soft palate, then auditory tube and palatine tonsil. Soft palate and palatine tonsil have been already covered. So now this is exclusively on auditory tube. It's an important short essay question for 5 marks. So very frequently asked question. See, some of the points regarding auditory tube you have already learnt. So when we spoke about the nasopharynx, you have already seen the pharyngeal opening of the auditory tube. Then so when we were talking about the muscles of the pharynx, so you saw the gap between the base of the skull and then the superior constrictor. So that is nothing but sinus of Morgagni. So there also you have already discussed about the auditory tube because auditory tube was passing through sinus of Morgagni. Now let us see. So what exactly is this auditory tube? So I can call this as osseo-cartilaginous tube because part of this is made of bones. Part of this is made of cartilage, hence the name osseo-cartilaginous tube. Now, what are the gross features of this tube? So we have already got to know that what is it? It is communication between the nasopharynx and then the tympanum or middle ear cavity. So it's a tube between the nasopharynx and then the middle ear cavity. So communicating these two. Then measuring about 36 millimeter in an adult and half of this will be in children, that is 18 millimeters in length. Now out of this 36 millimeter length in an adult, now 24 millimeter will be cartilaginous and this forms the medial part of the tube. The part which is nearing to the pharynx, I can call this as pharyngeal portion. So nearer to the pharynx, so this part measuring about 24 millimeters, it will be made of cartilage. And what type of cartilage is present here? You know, when we were talking about examples of elastic cartilage in the cartilage histology of cartilage class, so we gave 3 examples for elastic cartilage. So one was your eustachian tube, the other one was your external ear, and third one was epiglottis. So all 3 E's are the best examples for elastic cartilage. We spoke like this. Now, so eustachian tube is also an example for elastic cartilage. So that is the cartilaginous part of the eustachian tube which measures about 24 millimeters in length and it is placed medially. And now coming to the lateral 1/3. So the lateral 1/3 means so 12 millimeters. So this will be made up of bone. So that is osseous. So that's why we called it as osseo-cartilaginous tube. So out of 36 millimeters, 24 millimeters which is lying medially, it is made of elastic cartilage, and 12 millimeter which is made up of bone. So that will be lying laterally, means that will be nearing to the middle ear cavity. Now once we have seen the gross measurements, what it is communicating, now let us see what is the orientation of the tube. Assume that this is the nasopharynx and now this is the middle ear cavity. So if this is communicating the middle ear cavity to the nasopharynx, I said. So if this is nasopharynx, this is middle ear cavity. So it is communicating the middle ear cavity to the nasopharynx. This middle ear has got a medial wall, has got a lateral wall. Assume that this is lateral wall. The lateral wall of middle ear cavity, you have already learned that this is tympanic membrane. So this auditory tube, it is communicating the nasopharynx and nasopharynx is in communication with the nasal cavity. So air enters into the nasal cavity. So from the nasal cavity it goes into the nasopharynx and from there it goes to oropharynx, right? And then from there it goes to larynx. This is how we have learned. And from the nasopharynx through this auditory tube it can even come to the middle ear cavity. And middle ear cavity has got tympanic membrane. So tympanic membrane on the other side, it is exposed to the external environment. So air will be hitting the tympanic membrane from outside and air is being also hitting the tympanic membrane from inside through this auditory tube. So what is the function of this auditory tube? The auditory tube is meant to balance the air pressure on either side of the tympanic membrane. Assume that if there were to be no auditory tube at all, so air would have been hitting the tympanic membrane from outside. So at one point of time, the tympanic membrane would have bulged to such an extent because of the air which is being hit from outside. It would have got torn here because of the excessive pressure. So that's why, to prevent this and to maintain the position of the tympanic membrane, so air pressure to be balanced from both the sides, from inside as well as from outside. So this is being done by your auditory tube. So that is the function of the auditory tube. Now, so once we have seen what is the function of the auditory tube, so its gross measurements, now let us see the orientation of the auditory tube. So how it is placed. If you assume that this is the sagittal plane and this is the transverse plane or horizontal plane, so it is placed in such a way that this is the sagittal plane, this is the horizontal plane. It is placed in such a way that, so this is the tube. Now this is the pharyngeal opening, this is the tympanic opening or mid-layer opening. Now when you see here, it makes around 45 degrees with the sagittal plane. It makes an angle of about 30 degrees with the horizontal plane. So that shows that it is slightly inclined towards the horizontal plane. So it makes an angle of about 45 degrees with the sagittal plane, 30 degrees with the horizontal plane. It shows that it is slightly inclined towards that horizontal plane. So now this will be the pharyngeal opening. So this will be the tympanic opening. And now, so at the junction of this bony and cartilaginous point, if this is bony part, if this is cartilaginous part, you know cartilaginous part measures about 24 millimeters. Bony part measures about 12 millimeters. At the junction of these two, you can see there is a constriction here. This is called as isthmus. This is called as isthmus of the auditory tube. Now, once we have seen the outline of the auditory tube, what exactly it does, so from where to where it extends and what are the gross features of this auditory tube. Now let us see the location of the auditory tube and its relations. So location and its relations. So partly we have already studied this. So again it's like a revision class. Okay. So because in the mid-layer cavity, anterior wall, you have already seen the auditory tube. So again in the nasopharynx you have seen the auditory tube. So now here, so in relation to the sinus of Morgagni, so I will be showing you the location of the auditory tube. Now assume that this is mid-layer cavity. So this is the mid-layer cavity which looks like a cube, and here this is the mastoid antrum which is opening into the mid-layer cavity. Assume that this is the anterior wall of the mid-layer cavity. This one is anterior wall. Anterior wall is carrying two channels. So one of the channel will be here. This is the channel which is carrying the auditory tube. This is another bony tunnel which will be carrying your tensor tympani muscle here. This is the tensor tympani muscle. Tensor tympani muscle, and now this is mid-layer cavity. This is mastoid antrum, and now this is your auditory tube. Now let us increase the length of the auditory tube. So we know that this widens towards the pharyngeal opening, and when you observe, so when you take a cut section through the pharyngeal opening, it will be transversely oval in shape. So anterior wall of the mid-layer cavity has got three bony tunnels from above downwards. So above one will be carrying the tensor tympani muscle. Below one is nothing but the bony part of the auditory tube, and below that you will also see here anterior plus inferior wall of the mid-layer cavity will be nothing but here the carotid canal which will be carrying here internal carotid artery. That is nothing but your carotid canal. Now, so this is the pharyngeal end. This is the tympanic end of the auditory tube or pharyngotympanic tube. Now let us write the rest of the structures, like how it is passing through the sinus of Morgagni, all those things. So about this, so here this is one more bony projection what I am writing. This is the apex of the petrous part of temporal bone. This is apex of petrous temporal bone. Now below this, so if you observe, see this is the median pharyngeal raphe. Median pharyngeal raphe. Up here, this is the medial pterygoid plate with the pterygoid humulus, lateral pterygoid plate, spine of the sphenoid. This is the spine of the sphenoid. So spine of sphenoid, lateral pterygoid plate. This one is medial pterygoid plate. Now this is your pterygoid humulus. Pterygoid humulus. This we have already seen once again in the soft palate muscles discussion also. So pterygoid humulus. So this is medial pterygoid plate, lateral pterygoid plate. So this is your auditory tube. This is the pharyngeal raphe. Pharyngeal raphe, median pharyngeal raphe. We know the superior constrictor muscle, it takes origin from posterior border of the medial pterygoid plate, pterygoid humulus, and then pterygomandibular raphe, which runs from the pterygoid humulus towards the mandible. So now let us draw the superior constrictor muscle. So here it takes origin from the posterior border of the medial pterygoid plate and from below. So it is extending till the pterygomandibular raphe. So here, so this is your superior constrictor muscle. Only partly I am writing the superior constrictor muscle, and posteriorly it comes and gets inserted to the raphe. So this raphe can be written in green color. Pharyngeal raphe. So now this is your superior constrictor muscle. So this is superior constrictor muscle. Clearly between the base of the skull here, clearly between the base of the skull and then the upper border of this superior constrictor muscle. So can you see this gap here? So this gap is making way for the auditory tube here. So your auditory tube is passing through the gap between the base of the skull and then the upper border of the superior constrictor muscle. We know that this space is called as sinus of Morgagni. Sinus of Morgagni. So this we have already discussed in the muscles of the pharynx. Okay, so the gap between the base of the skull, this is base of skull, and upper border of the superior constrictor muscle, this will be called as sinus of Morgagni, and your auditory tube is passing through the sinus of Morgagni. Then what are the other structures which were passing through the sinus of Morgagni? We know in the last class we discussed, so taking origin from the apex of the petrous part of the temporal bone and then the medial side of the auditory tube. So we could see two slips coming. So one slip coming from the medial side of the auditory tube, the other one slip is coming from the apex of the petrous temporal bone. This muscle was called as levator veli pelleti muscle. So this is your levator veli pelleti muscle. Levator veli pelleti muscle. So that levator veli pelleti muscle also passes through the sinus of Morgagni. In addition to this, we also know that there are vessels which are passing through this sinus of Morgagni with the accompanying veins. So these are ascending pharyngeal artery here, ascending pharyngeal artery, and then ascending palatine branch of facial artery. So ascending palatine branch of facial artery, ascending pharyngeal artery itself. Ascending pharyngeal artery, we know this is one of the medial branches. So this is the medial branch of external carotid artery. Only one medial branch is there, that is nothing but here external from the external carotid artery, that is ascending pharyngeal artery. So ascending palatine branch of facial artery, then ascending pharyngeal artery, then the muscle, so that is nothing but your levator veli pelleti, then the tube, that is nothing but your auditory tube. So they pass through this sinus of Morgagni. So we always remember with the mnemonic sinus of Morgagni, the structures passing through are there MTV, not your music channel, MTV. M stands for muscle, levator veli pelleti muscle. T stands for auditory tube, and vessel stands for ascending pharyngeal artery with the vein accompanying it plus ascending palatine branch of facial artery. Ascending palatine branch of facial artery. So M stands for muscle, levator belly palati muscle, T stands for auditory tube, and V stands for vessels, that is ascending pharyngeal artery and ascending palatine branch of facial artery. So M, T, V. So these are the structures which are passing through this space which is between the base of the skull and then the upper free border of superior constrictor muscle. Now, once we have seen like how the tube is entering into the nasopharynx after passing through this gap, now let us see what are all the other muscles which are related to this tube. So from above, so you could see the levator belly palati muscle which was taking origin from the medial side. So from the same medial side you can also see one more muscle which is descending down. You are not seeing the origin exactly here, but you are seeing it descending down after taking origin from medial side. So this is nothing but your salpingopharyngeus muscle. One more muscle of pharynx, longitudinal muscle of pharynx, that is salpingopharyngeus muscle. It doesn't pass through sinus of Morgagni. It comes out like this. You can see here. So this is your salpingopharyngeus muscle. Salpingopharyngeus muscle. Then, so there is tensor tympani muscle which is above here. So from the medial side, tensor tympani. So you can see here the medial aspect of the tube gives attachment to three muscles. So this is your tensor tympani, this is your levator belly palati, and now here this is your salpingopharyngeus muscle. Then what is attached to the lateral side? We have already seen yesterday when we were discussing about the muscles of soft palate taking origin from the spine of the sphenoid, taking origin from the lateral aspect of the auditory tube. We could see a huge triangular muscle, right? So this was the huge triangular muscle which was taking origin from the scaphoid fossa, spine of the sphenoid, and then the lateral aspect of the auditory tube. So this triangular muscle, it formed a tendon. Then that tendon, it was winding round. It was winding round the pterygoid humulus and it came medially to form the palatine aponeurosis. Let us use some other green color. So now this is your levator belly palati muscle, tensor belly palati muscle. So the large triangular muscle taking origin from the spine of the sphenoid, lateral aspect of the auditory tube, and then the scaphoid fossa of the medial pterygoid plate. Now this muscle is called tensor belly palati muscle. So the lateral aspect of the tube is related to tensor belly palati muscle, medial aspect of the tube is related to levator belly palati muscle, tensor tympani, and then the salpingopharyngeus. So this passes through the sinus of Morgagni along with levator belly palati and then the tube itself, and then ascending pharyngeal artery and then ascending palatine branch of facial artery. So the medial end is opening here into the nasopharynx and the lateral end will be opening here into the interior wall of the middle ear cavity. So that's all about the auditory tube. Now let us see the relations. Here only if you observe, posteromedially this is related to three muscles, plus it is also related to apex of the petrous part of the temporal bone. If you come laterally, it is related to spine of the sphenoid, it is related to tensor belly palati muscle, and if you come here nearer to the middle ear cavity, you can see anterior wall is related to, two important bony tunnels, one above carrying the tensor tympani muscle and the other one below, that is nothing but your auditory tube itself, the osseous part. Below that it is also related to carotid canal. You can see here this is carotid canal and it is related to tympanic part of the temporal bone. So this is your relations of the auditory tube. So we know the junction of the bony part and then the cartilaginous part. So bony part will be lateral 1/3, cartilaginous part will be medial 2/3. At that junction you can see there is narrowing that will be called as isthmus. There will be narrowing that is called isthmus. So now this is all about the auditory tube. So from where it starts, where it ends, what it is communicating, what is its function, we have already learnt. And then what are the structures which are related to posteromedial aspect of the tube, anterolateral aspect of the tube, nearer to the middle ear cavity, here in the the sinus of Morgagni, where it is passing through the gap between the base of the skull and then the upper border of the superior constrictor muscle. In the nasopharynx, we have already written this diagram. So this was nasal cavity. So this is the anterior sloping portion of roof This is the middle horizontal portion and this is the posterior sloping portion, sphenoidal air sinus, pharyngeal raphe. Now this is the floor of the nasal cavity, hard palate, and then this is soft palate. So this is oral cavity. So region of chin, interior median eminence, that is laryngeal eminence. This is mandible, mandibular teeth, tongue. Now here in the nasal cavity we had seen three concha: superior concha, middle concha, inferior concha, superior meatus, middle meatus, inferior meatus. Behind the inferior concha, about 1.25 centimeters behind and below, we could see there was an opening. So this was called pharyngeal opening of the auditory tube. The upper and posterior margins of this auditory tube, we could see an elevation. This was called tubal elevation. So the pharyngeal opening of the auditory tube, it bears an elevation along the upper and posterior margin. This is called tubal elevation. Here you will see submucosal aggregation of the lymphoid tissue, which is otherwise called as tubal tonsil. So from the lower end of the tube, we could see there was a fold of mucous membrane which was running to the soft palate, salpingo-palatine fold. This was carrying the levator veli palati muscle, and then there was another fold which was carrying downwards, running downwards towards the wall of the pharynx. This was called as salpingo-pharyngeal fold. So this is called as salpingo-palatine fold. So now this is carrying the salpingopharyngeus muscle. This carries the levator veli palati muscle. So above this we could see clearly the fossa of Rosenmuller, and above that you could see the pharyngeal tonsil. So these are all the relations of your pharyngeal opening of the auditory tube. So that we have already seen in the lateral wall of the nasopharynx. So this is the outline, and then the structures which are related, and some features about the pharyngeal opening of the auditory tube. Now once we have learnt about all this, now let us see what is the blood supply, nerve supply and lymphatic drainage. Now passing through the sinus of Morgagni, accompanying the auditory tube, we could see the ascending pharyngeal artery and then ascending palatine branch of facial artery. The same two arteries will come to supply the auditory tube along with the middle meningeal artery. Now coming to the nerve supply of the auditory tube. So when you look at the whole of this auditory tube, the whole of it, the sensation will be carried by your glossopharyngeal nerve, except near the pharyngeal opening of the auditory tube, because this part of the pharynx is supplied by the maxillary nerve through the branches of your pterygopalatine ganglion. The same maxillary nerve through branches from pterygopalatine ganglion will be supplying the pharyngeal opening of the auditory tube. This is a very frequently asked Gross Potter question. What we do, we put a pointer here and we ask you, identify the probed opening. So this is nothing but pharyngeal opening of the auditory tube. Give its nerve supply. See, the whole of the tube is supplied by glossopharyngeal nerve. Near this end, that is pharyngeal opening of the auditory tube, it is being supplied by your maxillary nerve through the branches of the pterygopalatine ganglion. Coming to the blood supply, it is ascending pharyngeal artery and then the ascending palatine branch of facial artery. Coming to the lymphatic drainage, it goes to retropharyngeal group of lymph nodes, and venous drainage goes to pterygoid venous plexus plus retropharyngeal venous plexus. So venous drainage is to retropharyngeal venous plexus and then the pterygoid venous plexus, and lymphatic drainage goes to retropharyngeal group of lymph nodes. Now, what is the function of the auditory tube? We have already learnt here. It tries to maintain the air pressure on either side of the tympanic membrane. So this plays a major role. So whenever the person is traveling airway, okay, so when the plane rises, so there will be bulging of the tympanic membrane. So that has to be prevented by your air. So pressure from outside which has to be balanced. Okay. So when the aeroplane is landing down, there will be retraction of the tympanic membrane. So bulging of tympanic membrane, retraction of tympanic membrane, excessive bulging also, excessive retraction also, both has to be prevented. How this can be prevented? It is by the action of the auditory tube, which can maintain the air pressure on either side of the tympanic membrane. So this is another frequently asked Gross Potter question. So what we do, we put the probe here. We ask you to identify the probe structure. So that is nothing but the pharyngeal opening of the auditory tube. Give its function. So its function is nothing but to maintain the air pressure on either side of the tympanic membrane, or to maintain the equilibrium of pressure on either side of the tympanic membrane. One nerve supply we can say. The other one we can ask what is its function, or we can ask where does the other end open. The other end opens into the interior wall of the middle ear cavity. So that is the answer we expect. So that is all about the auditory tube. So we studied about the gross features. So what exactly is it? It's an osteocartilaginous tube communicating the nasopharynx to the middle ear cavity. So what is its function we learned? What is the orientation of this tube to the two planes? So sagittal plane and then the horizontal plane. So then the structures which are related, how it is passing through sinus of Marcagni to enter into nasopharynx. So what was its location in the nasopharynx and what it was related to in the nasopharynx we learnt. And then the blood supply, nerve supply, and then the lymphatic drainage and applied anatomy is to maintain the air pressure on either side. Sometimes what happens whenever there is any inflammation of the nasal cavity, for example, you can see air enters here along with some microorganisms, rhinitis. So rhinitis can cause even pharyngitis. So there can be closure of this tube because of the edema. So closure of this tube because of the edema. So that when you give anti-inflammatory drugs, it can open up and it can open with a clicking sound. So when you do Valsalva maneuver, that also you have to keep in mind. So that's all about. This is very whenever there is any closure of this tube, it will be very painful. That you have to remember. So that's about the auditory